actually part of why you're here today, is to tell us how we might go about knowing more. And so what are you guys doing to know more? Because again, that's the benefit of academic institutions, is how you can design things to learn more.
Yeah, I think the other thing before I go into that I think is important to know, and we know this from a study in New York where they tested all incoming women into a labor and delivery unit. They tested some, they had symptoms, those were positive, but then they tested over 200 asymptomatic women. So came in, no idea they had symptoms, no fever, no cough, and over 10% of those women were positive for COVID. The majority of them, some of them got a fever later, but the majority of them were shedding virus, were positive, have absolutely no symptoms, delivered their babies, went home, had absolutely no symptoms after that. What does that tell me as a physician? It tells me that there's a lot of people walking around the community pregnant who do not know they have the virus and are actually actively infected and shedding virus. It's reassuring because they're not getting sick, their babies aren't getting sick, and that's a good thing, but it basically begs the question, what's happening to all those women? Does it matter whether you're symptomatic or not? And that's kind of what we're hoping to study. So to answer your question, I think that one of the things that was most frustrating to me was the lack of data that we had at the beginning of this. No one who was pregnant in their first trimester has ever gotten COVID and delivered, right? Because if you put the timeline, if the first person that was pregnant in Wuhan in December that was 6 weeks pregnant, then that person is not even in their third trimester yet. So even though it feels like we've been dealing for this for years, it's only been months and we don't have a lot of data. The first trimester is a crucial period in pregnancy. It's a time all the organs form, the placenta develops, the baby's limbs develop, and it's a period that is a complete black box to us as it regards to COVID. So a group of clinicians here at the UCSF Center for Reproductive Health, we have neonatologists, we have microbiologists, we all put our heads together and we said, how can we find out more about the effects of COVID in pregnancy? And the best way that we could think of is we were going to recruit people very early in pregnancy, between 4 and 10 weeks. And that's difficult because no one wants to tell anybody they're pregnant before 10 weeks. But it is the only way we can truly understand, does the timing of infection matter? How does it matter? So we decided to recruit people somewhere between 4 and 10 weeks and study them throughout pregnancy, and then continue to study them and their baby until 1.5 years of life. And I think as we think of this and as we try to gather more data for our mothers, for our sisters, for our families, for our friends, and for our patients, learning what happens throughout pregnancy and after is what's really going to equip us all, physicians and providers and patients, to get those answers.
Well, it gives us some confidence in our answers, right? You and I both just talked about the fact that we're extrapolating the basis for our answers, but we actually do need a study to actually be able to say confidently, we've looked at coronavirus, meaning SARS-CoV-2, we've looked at COVID-19, and this is what can happen first trimester, second trimester, third trimester, or this is what doesn't happen. Because we need to be able to say that with confidence, as opposed to saying based on SARS, based on MERS, and if we're being honest, based on any one given population. So you use the word recruit. What is recruiting and how are you recruiting?
So this study, we call it the ASPIRE study. And when I say recruit, we want to enroll patients. We want to ask women who feel like they have the same questions, or they want answers to the same questions, and they want to contribute to the scientific literature. They want to be part of the study. I've spoken to so many women that are frustrated about the fact that we don't have answers. And it's not frustrating in that, like, I'm upset that you don't have them. They're like, she's upset that the world doesn't have these answers. So they want to be part of the solution. They want to contribute, and they say, if I can put my grain of sand to help get this answer, I want to participate and I want to help. So we're asking women that are between 4 and 10 weeks, adults only, to enroll in this study. They would come to our website, they would fill out a questionnaire, help them figure out if they're eligible, and we figure it out based on how far along they are in pregnancy. And if they're eligible, one of our research coordinators will enroll them in our study. What we're hoping to do is follow them throughout pregnancy. We will check their antibodies. So we don't want them to have to come to the hospital. We don't want them to be exposed. We know this is a big concern for women. So we send them a kit where they can prick their finger and put a little blood in a card. They keep those cards and they can do them every week in the first trimester and then every month later in pregnancy. That's really important because it will give us a sense of if they get infected, and we hope that's not the case, but we know realistically at the rate this virus is growing, a lot of our pregnant women will be exposed to the virus. Some of them are already exposed to the virus, they just don't know it yet. So we will ask them to give us this blood sample, send it back to us, and we will analyze it. We're going to ask them to give us their symptoms. So they're going to go through a quick questionnaire daily at the beginning and then a little bit less later on in pregnancy. We really want to focus on that first trimester, but follow them throughout. They'll tell us when they have symptoms, if they have a cough, if they had a fever, so we can really pinpoint the time of infection. Yeah. We'll then ask them questionnaires about stress and life and then follow them. And then we ask them to let us see their medical records. This is, of course, completely confidential, but it will build a really big repository of data that when we have 1 or 2 patients, it's hard to tell what would have happened otherwise. But when we start seeing, we're looking to collect 10,000 patients and have them help us get this data. When we analyze data from 10,000 patients, a lot of which are going to get exposed to COVID at different points in pregnancy, we're going to have a much, much better understanding of how this virus impacts pregnant women, how it impacts babies in utero, how it impacts children early in life. And I think it will help us give women answers that we don't have right now.
Now, for a lot of people listening, they're probably thinking 10,000, that's not a big number, but that's actually a massive undertaking.
Yeah.
The truth is, most of the papers that have been published so far, we're looking at numbers like 30, 11, 156 is the biggest I've seen so far in terms of groups of women who've been studied. Well, 200 out of New York, like you mentioned. But really, we're talking at best a couple hundred in terms of pregnant women who've been studied so far. You guys are looking to enroll 10,000. That is a huge undertaking. Now, why 10,000? Just so those who are listening who aren't necessarily familiar with how studies are designed, what is 10,000 here? I mean, in my mind, I'm thinking powered to show a result, but explain to those who are listening why 10,000? Because again, like I said, that's a massive undertaking.
So 10,000 patients is a number that we came in by doing something called a power calculation. So we know that some of our patients, unfortunately, unrelated to COVID, might have miscarriages in pregnancy. We know some of our patients might have things happen and drop out of our study. We hope that doesn't happen because the more patients we can keep inside, the better the data that we'll have. But we know that if we start with 10,000, we're not going to end with 10,000. Some patients are not going to be exposed to COVID throughout their pregnancy, so they will be helpful because we'll know what happens if you didn't get exposed. Some patients are going to be exposed at different points. And I think that having a large number like 10,000 will help us actually draw realistic conclusions. So we wouldn't be comparing one person to one person. We'll be comparing 600 in this group to 2,000 in the group to 3,000 in the group to however many that didn't get infected. And we'll be able to draw realistic conclusions. I think another thing that's really important is that, we want studies to be diverse. We want people to be different. We cannot have, white hetero male, female patients that are of a certain socio-demographic class and then say, well, this is what happened to this group of people, so that must be what happened to everybody. We need to make sure that the people that join our study represent the population that we serve. And we know that our population looks very different. Some are Black, some are white, some are Hispanic, some are rich, some are poor, some live in New York City, some live in rural Montana. And we need to make sure that when we do a study, the population that we want to represent is represented in our studies. So we're trying to work really hard to reach people of all facets of life so that we can answer questions for everybody, not just for a few.
Which is good to point out here, because we've already talked about the fact that you are based in San Francisco, but this is not a San Francisco study that we're talking about here. This study is intended for anyone, anywhere in the United States. So you just said that you will send things to a patient. So let's say there's someone listening right now who lives in Central Florida, and you're talking to us from San Francisco. Can someone who's newly pregnant in Central Florida enroll in the study?
Absolutely. And, we started last week. We have people who have signed up in 28 states. We've had 60 fertility clinics who see patients usually earlier in pregnancy. So they're kind of hooked up with these patients. There are partners. They're helping us recruit. They're helping us spread the word. So in a week, we recruited from 28 states. I have a friend who lives in Central Florida who messaged me today after seeing my post on Instagram. She is 4 weeks pregnant. She is incredibly excited. And she said, I had been looking for a way to contribute. This is so important. I need these answers for myself. And even though I might not get them for myself in time, I will get them for my friends. I will get them for my next pregnancy. And she's engaged. So anybody in any of the 50 states is eligible to participate. We will ship our kits anywhere. We want people from all over the place. And if you're not sure, come to our website, fill out our questionnaire. We can let you know if you're eligible or not. And if you're not eligible and you feel like you want to help, share with your friends.
Yes. So you said 50 states, so that means Alaska, Hawaii included. How about the territories? Let's say Puerto Rico. Can they participate, or would they have to be on the mainland?
I actually don't know the answer to that question. We say 50 states and that's what we have, but it is part of the United States. So, if you're from Puerto Rico and you're listening and you want to participate, message me. I'll figure it out for you. And I want you to participate because you're part of our country and we want to have you included as well.